This cream is used to treat acne by decreasing the number and severity of acne pimples and promoting quick healing of pimples that do develop. Tretinoin belongs to a class of medications called retinoids, and it works by affecting the growth of skin cells. For best results, apply a thin layer of the cream to the affected area once daily before bedtime. It's important to use sunscreen and avoid prolonged sun exposure while using this medication. It may take several weeks to see the full benefits of this cream, so be patient and consistent with your treatment. Remember to follow the instructions from your healthcare provider for the best outcome. Before using Tretinoin 0.025 topical cream, make sure to wash your hands and gently clean the affected skin. Use your fingertips to apply a small amount of medication in a thin layer, usually once daily at bedtime. You can use a gauze pad or cotton swab to apply the liquid. Wait 20 to 30 minutes after cleaning your face before applying the medication, as directed on the label. Remember to only use this medication on the skin and avoid applying it to certain areas, such as the inner lip area, inside the nose or mouth, and on cut, scraped, sunburned, or eczema-affected skin. Also, be careful to avoid getting the medication in your eyes, and wash your hands after using it to avoid accidentally getting it in your eyes. It's important to note that during the first few weeks of using Tretinoin, your acne might appear worse, but this is because the medication is working on pimples forming inside the skin. It may take up to 8 to 12 weeks to notice results from this medication. Use it regularly at the same time each day in order to get the most benefit from it. Do not use a larger amount or use it more often than recommended, as it will not improve your skin any faster and may increase the risk of developing redness, peeling, and pain. This medication is available in different strengths and forms, such as gel, cream, or solution. The best type for you will depend on the condition of your skin and your response to therapy. If your condition lasts or gets worse, make sure to consult with your doctor. After applying the medication, you may feel warmth or stinging. In the first 2 to 4 weeks of using the medication, you may experience skin redness, dryness, itching, scaling, mild burning, or worsening of acne, but these effects usually decrease with continued use. If you have very dry skin, using a daytime moisturizer may be helpful. If any of these effects last or get worse, tell your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. If you experience blistering/crusting of the skin, severe burning/swelling of the skin, or skin discoloration, tell your doctor right away. A very serious allergic reaction to this drug is rare, but seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. And remember, if you have any concerns about the side effects, don't hesitate to speak with your doctor. Before using Tretinoin, make sure to inform your doctor or pharmacist about any allergies you may have, especially to vitamin A-related drugs. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Tretinoin may make you more sensitive to the sun, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen daily. It's also important to wear protective clothing when outdoors. If you get sunburned or have skin blisters/redness, make sure to tell your doctor right away and wait until your skin has completely recovered from a sunburn before using Tretinoin. While using this product, it's best to avoid electrolysis, waxing, and chemical depilatories for hair removal on the treated areas. If you have recently used products containing sulfur, resorcinol, or salicylic acid, make sure to use Tretinoin with caution and wait until the effects of such products on the skin have decreased before using Tretinoin. If you are pregnant, this medication should only be used when clearly needed, as it may harm an unborn baby. It's important to discuss the risks and benefits with your doctor. Additionally, it is unknown if this drug passes into breast milk, so make sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's also essential to avoid using other skin products that could be harsh, irritating, or drying on the treated area, such as hair-perming solutions, alcohol/lime/menthol-containing products, medicated or abrasive soaps or cleansers, and products containing sulfur, resorcinol, or salicylic acid. Additionally, benzoyl peroxide can be very irritating and may decrease the effectiveness of tretinoin if applied at the same time. It's important to talk with your doctor or pharmacist about the safe use of prescription and non-prescription benzoyl peroxide products. Remember to always follow your doctor's approval and advice when using medications. If this medication is ingested, it can be harmful. If someone has taken too much and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. For residents in the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Tretinoin 0.025 topical cream is used to treat acne. It works by affecting the growth of skin cells and decreasing acne lesions. Apply a thin layer of the cream to the affected area once a day before bedtime. Use a gentle cleanser to wash your face before applying the medication, and avoid using harsh or abrasive products on your skin. It is important to follow the instructions from your doctor and apply the medication at the same time each day for the best results. It's important not to share this medication with others. You can use cosmetics, but make sure to clean your skin thoroughly before applying the medication. Some cosmetics and soaps may make your acne worse, but moisturizers may be safe to use. When buying cosmetics, moisturizers, or other skin care products, look for non-comedogenic or non-acnogenic on the label, as these products are unlikely to make your acne worse. It's important to remember that acne is not caused by dirt, so cleaning your skin too often or too vigorously can actually irritate your skin and make your acne worse. If you have any concerns about which products are safe to use, be sure to ask your doctor or pharmacist for advice. If you forget to apply this cream, apply it as soon as you remember on the same day. If you remember the next morning, wait until your next scheduled application. When storing Tretinoin 0.025 topical cream, make sure to keep it at room temperature and away from heat or fire sources. If you have the gel preparation, be cautious as it is flammable. Also, keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the correct way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.